Hi, my name is Stacey Pitts, and I'm the co-founder of CBD BioCare. And joining me today is Dr. Frank Michalski, and he is a chiropractor and functional medicine professional and physician in Buffalo, New York. And he also happens to be a CBD BioCare and a CBD expert. Hi, Dr. Frank.
Good morning, Stacey. Good to see you.
Thanks, you too. So we've discussed a lot of different topics, and today we're going to focus on headaches because so many people, including myself, occasionally suffer from headaches. I personally get a headache when I'm stressed, if I feel a cold coming on, for a number of reasons. And so let's talk about headaches and how CBD can potentially help people. But let's first understand why someone would even get a headache.
Yeah, of course. So I'll start with the most basic of the headaches, right? Which would probably be your day-to-day person who's suffering from what we call in our offices a cervicogenic headache, or that traditional tension headache that people suffer from, right? So this is the headache that usually starts in the muscles of the neck. It travels up through the back of the head, and then it usually wraps around the head like you're wearing a baseball cap or something along those lines. And that's your traditional tension headache that I think a lot of Americans suffer from. So those headaches, specifically, not migraines, tension headaches, usually the root cause has to do with muscle tension in the neck, anxiety. Maybe it's TMJ, where someone is constantly clenching their jaw. Or maybe it's just day-to-day stress, right? So many people are stressed, whether it's at work, family life. People don't realize it, but they tend to put up their shoulders like this all the time. We're always constantly telling people, relax, let your shoulders drop down, because the more we do this, the more we're creating tension in the back of those muscles in our neck. And that's then what can lead to a tension headache. Some people will have tension headaches or migraines, which we'll talk about in a moment, from actual problems within the neck itself. So if anyone's ever had a disc herniation in the neck, if anyone has stenosis or really bad arthritis in the neck, those are also common causes of tension headaches. Now, the seasons are changing here in Buffalo. We're going to see a lot of seasonal allergy related headaches as well too, which usually present very similar to a tension headache. But that would be one of the main causes that we see: tension in the muscles in the back of the neck, shoulders that aren't relaxed. So that's your basic headache. Take some over-the-counter Aleve, aspirin, Advil, and that works for most people. Now, the other type of headache that a lot of people suffer from is a migraine. And a migraine is different from a tension headache and the cause of a migraine. So it's still a pretty elusive topic. It's hard to say, even when you look through the medical literature and talk to experts, they don't know 100% what causes migraines. But there is a pretty standard working theory out there. So you have a nerve in your head, and it's called your trigeminal nerve, okay? And that nerve spans out, and it has innervation to the top of my head, through the side of my face, and then going down through the jaw. So when people get migraines, it's usually on one side, and it's usually a terrible pain, right? They describe it as just this horrible pain. They're vomiting. They can't be around light. It lasts anywhere from four hours to 2 days. Sometimes people will get visual disturbances with it. And ocular migraines, you may even see vision loss temporarily in those cases. So what that's believed to be related to is overstimulation of that trigeminal nerve, or that trigeminal-vascular system. So what happens? That nerve becomes irritated. They don't know exactly what the irritants are, but sometimes it's food. Sometimes it's weather changes. In females, hormone changes can be a trigger. It creates overstimulation of that nerve. We then get inflammation of that nerve. And that inflammation, if you remember back from our previous podcast, results in a expansion of your blood vessels. So they open up and all these inflammatory chemicals go rushing. The problem is, unlike when that happens in your low back when you hurt a nerve and you get sciatica or pain, this is in your head. So the result, or the working theory, is, okay, this is what results in a migraine. When that happens, other chemicals are released, other neurotransmitters, and one of them specifically is glutamate. And they're studying that and saying, wow, so once we have this aggravation of the nerve, once we have all these inflammatory chemicals released on top of it, now we're getting these stimulatory chemical transmitters released. And that leads to even further excitation even more aggravation, and an even worse migraine. Now, that's the primary working theory. The one that we're going to focus on talking about that really relates even more so to CBD and its potential benefits has been recently studied, and they're starting to look at issues within the endocannabinoid system. And one of the studies, I'll reference this in our write-ups for it. I'll give people a link to the study. They studied the cerebral spinal fluid of female migraine patients, females who have had frequent chronic migraines. And what they actually found was they had lower levels of naturally occurring cannabinoids in their cerebral spinal fluid. And I mentioned this back in another podcast. They had higher levels of enzymes that destroy your body's own cannabinoids. So some of the research is now looking to say, wait a minute, is this an endocannabinoid system problem? And it's very exciting, but that's very new research. So it's certainly not set in stone. But as I mentioned, after we discuss this today, I'll leave the link in the write-up for everyone to see for themselves. So
it's really fascinating. Every topic that we have discussed thus far always is talking about inflammation, right, of different areas of our body that cause a reaction. Our body reacts with a headache or whatever the issue is. So I'd like to talk about how CBD can help with this inflammation and help people, whether they're suffering from a common headache that has to do with maybe, as you mentioned, a hormone imbalance, stress at work, tension, or on the flip side, how CBD can help somebody possibly if they have a migraine.
Sure, of course. So I'll read some of these numbers off too. I always find this fascinating because I want people to think about the number of people that are affected by this, right? It brings it into light. And then I'll go into that. I wrote down some of the statistics. So people dealing with headaches, these statistics were more focused for migraines. Let me tell you this. So 1 billion people globally, 36 million in the US alone, 19% of those individuals tend to be female, 9% tend to be male. We have 14.2% of adults in the United States have suffered a migraine within the last 3 months. And here's even one of the more alarming statistics. This is costing us roughly $36 billion a year in healthcare costs and lost time from work. If anyone's ever had a migraine, work becomes very, very challenging. 25% of people who suffer from migraines would most likely benefit from some type of preventative care. And they feel that 12% of those people, if taken regularly, would be able to avoid chronic medication usage for migraines, which a lot of people don't realize this, but when you're taking medications on a daily basis for migraines, there's a lot of studies linking the medications turning an acute migraine into a chronic migraine. So prevention is a big thing. And that's really where you start to get excited about, okay, so how might CBD help? So with all that being said, where a lot of the research is focusing on CBD helping migraines is looking at those endocannabinoid deficiencies in people. So I'm going to explain this again like we did once in another podcast. Your body makes its own cannabinoid levels. Over time, chronic stress, exposure to illness, trauma, our body's cannabinoid levels appear to decrease over time, okay? Some people at a more rapid rate than others. Why is that happening? Because there's an enzyme in the body that's destroying your body's own cannabinoids. When you take CBD oil, it blocks that enzyme from destroying your body's own cannabinoids, helping your body make more of its own. This restores that homeostasis or that balance to the endocannabinoid system. So that reference that I made earlier to the study where they were seeing decreased endocannabinoids in female migraine patients, you could see how that could potentially benefit them. Now, that's not the only benefit either. People who suffer from migraines may be familiar with a term called an aura. This is kind of like a warning sign for people before a migraine is going to hit. They might start to develop an extreme sensitivity to light, or perhaps their senses increase a lot. Smell, they become very sensitive to smell. Or they start to see little flickers of light in their eyes, or maybe their vision gets a little funky. This is called an aura. And that aura, one of the working theories is that it's related to a strong neurotransmitter release called glutamate, which I referenced earlier. it appears that CBD actually helps to block glutamate, which could potentially help to ease a lot of those symptoms. Now we know too, with migraines, there's nausea. CBD has been shown to help with nausea, right? These individuals also tend to suffer from anxiety, depression, and insomnia. We've talked about it before in other podcasts, but CBD has been shown to help with those things, each of those, depression, anxiety, and sleep. So if we can get this individual sleeping better, if we can get this individual stressing less, if we can help them with the anxiety through CBD, could we potentially see less migraines? And some of the literature that we're seeing is saying, yes, CBD appears to be best used as a preventative treatment for migraines. So this isn't something that you would take just when you have a migraine. In fact, the research on that is kind of mixed if you're looking, and the doses that people are having to take to break a migraine once it hits is usually upwards of 400 milligrams, and that's typically involving some type of THC with it that they're seeing. But from a prevention standpoint, they're saying that dose between 10 to 100 milligrams a day, taken every day, appears to play a role in preventing that really, really bad migraine, that really bad attack. When we work with patients and we're helping them with taking the correct serving amount, in our case, the correct dosage, what we're explaining to them is if you see less severity of the headache, that's a great thing. If you see less nausea, we're on the right track. If your sleeping is improved, that's a great thing. If the duration of the headache, maybe they usually last you 4 days, this one only lasted a day. Those are all signs of progress, and that we've set up that individual with the right serving size or the right amount for them. So that's one of the ways that we gauge it. We usually say, okay, let's start you at 10 to 30 milligrams a day, taken anywhere from 1 to 3 times a day. In the case of migraines, we usually recommend morning, afternoon, and evening in increments of 10 milligrams, and then we increase until we see the desired effect. In our cases, I don't have many people over 100 milligrams, but if you look at some of the studies out there, I think it was in India, I don't remember if it was in India or Europe, but they actually ran acute breakthroughs for migraines using CBD, and they were finding you needed dosages upwards of 400 milligrams, usually with an inhaled THC for it to be effective in actually breaking a migraine attack. Now, with that being said, one of the things that I do like to emphasize is your roll-on gel and the topical 500 milligram pain cream, that works. I get so much feedback from people, and of course we don't have clinical trials on that, but I get people who tell me they roll that onto their temples, right above their eyes, and then along the back of their neck, and they seem to do fantastic with it. Something will tell, they say it just helps to ease some of that pressure, right? And one of the things that we'll tell people too when it comes to dosing it orally that I wanted to mention, okay, so you do the roll-on first, and then we explain to people to put the oil, a few drops, right in the back of either side of your jaw. This is where your trigeminal nerve sits, especially for those migraine patients. So we find that to be more effective than just taking it under the tongue, especially for that breakthrough pain relief if they're trying to take that approach. But yeah, just a few little drops right here in the jaw to kind of dull that trigeminal nerve. We know that CBD oil taken orally acts similar to opioids without all the negative side effects. It turns down those pain sensors on the nerves. It turns down the volume on those. So I find that combination to work very well. Tension headaches, they do great with the roll-on, I would say. They do quite well with it.
Yeah, I really love that you brought that up. You know, it's funny because I mentioned that I was with a friend of mine yesterday who has a lot of problems with migraines, headaches, and she also has fibromyalgia. So it's related to the pain and tension in her neck. And she said that she carries the roll-on, which is this, by the way, that we're talking about. And when she wakes up in the morning, if she feels that pressure, she just literally rolls it on the back of her neck like this. And then like right in this area on your muscles right here, rolls it on, and that's it. And as it dries, and within about 5, maybe 7 minutes, you'll also feel that cooling effect. So it really is amazing. She said if she wakes up and does not have the pain bomb by her bed or in her purse, she freaks out. She says sometimes I leave it at work because within 20 minutes, the headache does not become a migraine. She can literally stop it. So that's the tension. I get the same issue, and that's why it's always on my desk, is because I'll be typing, maybe talking on the phone, typing, and as you mentioned, I find myself that my shoulders, I start to do this. So I love what you're saying about the prevention, especially for the migraines, that you're taking the CBD oil as a preventative measure, but then again, more of that acute headache that you get from the tension or stress, putting the roll-on on. This is the other product you were mentioning. This is the 500 milligram pain balm, which I know you pretty much offer these products exclusively in your office,
Absolutely.
because they're so effective. So, and Lori and I were talking, because we almost feel like we're constantly trying to sell people on it, just sharing the story about how much success we have. And I told her, I said, I hate that I don't want people to feel like I'm just trying to pitch them. It's really that good, and it's really that awesome. And you want everybody who suffers from headaches or that tension, that pain in their neck, you want them to know about it, because it works so well immediately within literally seconds of putting that roll on, you're going to feel the relief. And I love that like I said, what you talked about is that preventative measure of even starting before the actual symptoms present themselves.
Completely. And that's really where the research is focused on. And that's really where you're seeing it being most effective, especially when you're talking about just a CBD and a non-THC thing. It's really focused on using that as a prevention. And people who take, I should mention this too, you have to work with your physician, obviously, if you're coming off a medication or doing things. But people who we've had taking harsh medications for migraines, once they've incorporated CBD, and again, under the guidance of their physician, they've been able to cut back on some of those medications. And that's a beautiful thing, because they come with side effects. Or even the roll-on. We had one case, and again, this isn't a clinical trial, it's a case in our office. We had someone who would go for regular Botox injections, and they would get 26 trigger point injections every time they go, and the muscles in their neck and their forehead all over. And since they've been using the roll-on, they said they go so infrequently now. They were like, it's amazing how much we've been able to cut back on those injections just from that. So you see some really amazing stuff with that.
Yeah, it's true. I'm starting to get the cooling effect here. I just put it on. I said 5 to 7 minutes, but I've never really timed it. But you start to feel that cooling effect, that it's working, right? It just starts to feel really awesome. So what would you say as far as red flags? I also want to take this a step further. And when is a headache something that people really need to be concerned about? That maybe it's not tension, maybe it's not stress, and CBD might help, and even some of the CBD products that we've talked about might help, but it also might be a red flag that there's something else going on, because we never want to oversell, if you will, the benefits of CBD. CBD is a very holistic supplement, and as you've mentioned several times on these interviews, that there's other factors. You want to be taking care of yourself. It's not the end all be all miracle prescription, right?
Yeah.
So let's talk about when a headache or a migraine may be representing a bigger issue.
Yeah, so the biggest concern, and in my profession, this is something we always have to be aware of, is this the signs of a true vascular event? Is this a stroke, or is this a TIA where we're actually losing oxygen to the brain? That's where you really want to be concerned. So we always tell people, if we have someone who's an adult and they've never had headaches before, and they've never had migraines, and they're suddenly just starting to develop out of nowhere, you need to go get that worked up. And in most cases, if you go, you'll be sent to a neurologist. They will almost always do imaging on the brain, because and I hate to say this, because you don't want to make people worry every time they go on Google and search headache, oh my God, I'm dying. No, but you do have to be cautious anytime there's a new onset of a headache. If you're a person who doesn't get headaches, and all of a sudden you're getting these really intense headaches, you have to go see your physician, go see a neurologist. Chances are they're going to order MRIs, CAT scans. They want to make sure that you're not having the start of a stroke. We see in our offices a lot of people with carotid artery issues, plaquing develop, and that sometimes I think can create their headaches. So we, of course, want to be aware of those people with true vascular problems. Anyone who has a family history of cancers, autoimmune diseases, you're going to want to make sure that you get a proper workup to make sure that this headache is just that, which most headaches are, just a standalone incident, but you want to make sure that it's not the result of an autoimmune disease or, God forbid, some type of cancer, especially if that runs in your family. And very, very infrequently is this the case. But again, if you're a person who hasn't had headaches, there's some bad family history and you're having that, that's a big deal. Of course, if you have a headache and you have speech issues, you're all of a sudden having vision issues, you're worried that that person's potentially about to have a stroke. So in those cases, you always want to go. And that's a tricky case because ocular migraines, you can actually have vision loss, and it's not a stroke, it's just a symptom of a migraine. But that would be something. Another common symptom we see in migraine patients is actually numbness and tingling in the extremities. That can be part of that aura, that can be related to the anxiety due to the onset of a migraine. We always want to send those people for a proper workup too when those symptoms get really bad. So those would be the cases. And what does that leave it at? Really, on a headache, if you haven't had a history of headaches that you've talked to someone about, you should get it properly assessed, because you really don't know with headaches. Headaches are a little bit trickier than back pain or shoulder pain or those instances, but absolutely.
Right. So just to recap, taking CBD sublingually, and as Dr. Frank mentioned, towards the back of your mouth for taking a CBD oil. And you want to refer to our website, cbdbiocare.com. Under CBD 101, there's a whole description that talks about serving sizes to give you an idea of how much you should take and where you want to start. The other thing that you can do, of course, that's preventative. The other thing that you can do is take the roll-on. We also have the pain balm. These are just some tools for you to have if you are suffering from pain in general, or specifically speaking today, migraines or headaches. To wrap this segment up, I would like to also give you the floor to be able to talk about other supplements that are beneficial outside of CBD that can possibly help people who are suffering.
Yeah, I was just going to say, so one of the things that's neat about our offices is, right, we try and take this multifactorial approach to the migraine. What's causing it? What are the triggers? Is it hormone problems? Is it food problems? Is it a chronic inflammatory disease? We try and get a diagnosis. Then we determine, okay, it's migraines or it's tension headaches. What can we do to help offset that naturally? So, and I don't know if you're familiar with these techniques, Stacey. Have you ever heard of Graston technique or instrument assisted soft tissue techniques or anything like that?
No.
Okay, so it's commonly practiced by chiropractors or physical therapists. Cold laser therapy is another technique that's awesome for helping with tension headaches and migraines. So how I explain it to people is, I'll give a little demo. The muscle fibers in the back of your neck, they should be lined up nice and smooth. So I turn my head and my muscle fibers glide back and forth, okay? And a tension headache or a migraine, imagine those muscle fibers developing knots. Have you ever heard someone say, like, oh my God, I have a knot in the back of my neck, right? So we go through with what's called cold laser therapy. That therapy, it's a low-level laser light that decreases inflammation, increases blood flow to the area, and helps regenerate new healthy cells. So we're working on the muscles in the back of the neck. The next thing we do is called Graston technique, or instrument assisted soft tissue technique. And that's where we actually use steel or plastic tools, and we apply a little bit of cocoa butter to the back of the person's neck. And we actually go in and massage out those trigger points, those muscle fibers, to try and realign them properly. So a lot of people get treatments for migraines will go get injections to try and break up those trigger points. That tends to be a much more comfortable therapy than the injections. So you have the combination of the cold laser, the Graston technique, and then we'll usually provide some traction, or if it's safe, a chiropractic manipulation at the end. A lot of people get headaches just from pressure on their nerves. So just by tractioning the neck, there's products online, the neck hammock, things like that, we can get those people a lot of relief, and it's almost instant. And then, of course, our recommendation is, in most cases, we're always following up with either the roll-on, the cream, or an oral solution, or a combination of them. Now, other supplements, too, that you'll frequently see tested for in blood work or recommended, there's a very popular one out there called MyRelief. It's feverfew, magnesium, and vitamin B6. That's a very popular one. I'll have a lot of patients who will take a little mixture of an antioxidant cocktail, and a magnesium supplement combined in almost like a shot. That works really well too. But I would say those are the big ones. Your B vitamins, feverfew, magnesium. Those are your most common supplements you see used to address migraines on a day-to-day basis, I would say. Yep.
Okay, that's great information. And so we're going to get rid of the cocoa butter, and I want you to use the pain balm next time you do the therapy.
So that's a great thing. Actually, believe it or not. So this is a funny story. So you could absolutely do that. People could absolutely use that pain balm. And I would tell you this, depending on the practitioner, that is a great way to introduce it to someone. And depending on how much of it you go through, maybe a mixture would be best. Yeah, of the two. But that works very well. We have massage therapists who do that. We have chiropractors who include the creams right into their gels for the Graston or any of those techniques.
Okay, great. I think that was fantastic information. I have this fantastic cooling effect right now for the roll-on. So thank you for your information and your knowledge. Always a pleasure speaking with you.
You too, Stacey. Great.